Hey everyone, thanks for coming to class. Sorry this is a recorded session. I had done this slideshow or this PowerPoint, planning on a live session, so some of the stuff won't be relevant, but it's all good. We'll get through it probably relatively quickly, but there's a lot of information in this unit, and for the assignments you're going to need to know specifics. So I would recommend maybe taking notes, and if I go too fast, because it's hard when I don't have people in class asking questions, you can always go back, rewind this little screencast. Okay, so what did we talk about last week? We talked about preventative, preventing diseases, right? And we did that web quest in class together, which was awesome. And this week, we are going to talk about CPR and first aid. I'd love to know if any of you have ever taken it. If you have in the past, it changes pretty frequently, so that's kind of a bummer about it. I used to teach it, and it's definitely changed. It's minutely, but it's in things that you need to know, okay? So if you have taken it in the past, then you might see some slight differences. So I'm also wondering, and of course you guys aren't here, but has anyone ever needed to use it or seen it being used? I've actually given CPR a couple times, definitely first aid many times when I did ocean rescue, and it's amazing. I mean, it actually does really work, and it's hard to do wrong if you follow these simple steps, okay? So today's objectives, we're going to talk about the correct way to administer CPR and the Heimlich maneuver, which is used for people who are choking. We're going to describe situations you might need first aid, and we're going to identify methods to stay safe around your house and in public so that you do not need first aid in the first place. I don't know if we'll get to these last things, this last one today, but I think that might be a little bit in the end of your unit. One thing I want you to know is, from me going through this PowerPoint, you will not be certified in anything. You still need to take a certification if you want to be able to use any of these things, and I highly recommend you doing that if you haven't already done so. Never know when you might need it. Okay, adult and child CPR. So what does CPR actually do? What it does is when the heart stops, and in order to do CPR, there must be no pulse, okay? If there is a pulse and someone's not breathing, then you do rescue breathing, which they do not cover in this unit. Rescue breathing is breaths. I think it's 1 every 5 seconds. That's what it used to be. And you do those until the heart stops or until help comes. And then if the heart stops, you start CPR, which CPR basically, you're doing chest compressions and breathing. You're getting oxygen into the blood supply with the breaths, and with the compressions, you're acting as the heart, which obviously you're not as efficient as a heart with these compressions, but you're getting the blood to circulate through the body and keeping blood going to the brain and to all the other tissues of the body and getting that oxygen to all those places as well. So it's really important, and it's important to do it within the first 15 minutes that somebody loses consciousness and their heart stops, because after 15 minutes they start going brain dead. Okay? The steps. First thing you want to do is you want to check for unresponsiveness. So, hey, are you okay? Tap, talking to them, see if they respond. Then you want to call 911, or you have someone else call 911. Hey, call 911. This person's not breathing. They don't have a heart rate, or they don't have a pulse, and then you begin CPR. So to begin CPR, you're going to open the airway and listen for breathing. And in your unit, they have a video of somebody doing it. So if you haven't seen it, I suggest watching it. And they're doing it on a mannequin. So open airway, which is you're going to tilt the head back, lift the chin. If no breathing, you're going to give 2 breaths. So you want to, as you're giving the breaths, you want to watch out of the corner of your eye to see that their chest is rising, because that way you know you're getting air into their chest. Then you're going to check for a pulse, and you're going to begin compressions, 30 compressions. In an adult, you're going to go 1.5 to 2 inches deep in the chest. Your hands are placed between the nipples, okay? You're going to use 2 hands, one over the other, and if I had you guys in class, I would turn on my, I guess I could do it still, and I think you could see it. Let me do that. Actually, never mind. So you would do the one hand over the other with the heel of your palm into the middle of the chest right between the nipples, okay? And they'll show you in the video in your class, in the course. So 30 compressions, then you're going to go 2 breaths after you do 30 compressions, and then you're going to do alternating those 2 breaths and 30 compressions until 911 or help arrives. If there's 2 people to help, one person gives breaths, the other person stays and gives compressions, okay? So one person's going to be on the chest, palms on the chest all the time, 30 compressions, they stop, 2 breaths, they can make sure the chest is rising, and then they go back to compressions. And again, you want to do this until help arrives. CPR for a child is very similar to that of an adult. You're going to give CPR for 2 minutes, and this is wrong right here, so let me change it real quick. This is 1/3 of the depth of the chest. Sorry about that. That's something that's changed. Okay, so CPR, you're going to give CPR for 2 minutes before you call 911. The reason for this is most children are not going to have a heart attack, right? Adults have a heart attack. So that's why you need to call 911 first, because you are not going to be able to save someone who has a heart attack. A child, sometimes they can get an electrical shock. There's lots of different reasons a child can need CPR, their heart can stop. So within those first 2 minutes, if you do CPR, a lot of times the child will be revived. Not always, but do it for 2 minutes before sending someone to call 911 or calling 911. If someone was there, I would say have them call 911 right away. If it's just you alone, do the 2 minutes first. For a child, you're also only going to use one hand for the compressions instead of 2 like the adult. And the compressions are going to be, the depth of the compressions are going to be 1/3 the depth of the chest. So if the child's chest is 5 inches, you want to do about 2 inches deep, okay? So you just kind of got to, measure that. Okay, infant CPR. Question: how old would somebody be to be considered an infant, a child, or an adult in CPR? An infant is considered anybody 1 and under. A child is somebody 1 to 8 years old, because it's more about size than it is about actual adult. And then an adult is anybody greater than 8 years old. Okay, so infant CPR. Check for responsiveness. Hey baby, are you okay? Shake them, see if they'll wake up. Lay them on their back, open their airway. So it's different to open their airway with an infant than it is with a child and an adult. With an infant, you do not tilt their head back. You put them in a neutral position, because if you tilt the head back, you actually close their airway. So you want their spine to be neutral, which is a straight line, okay? Lift a little bit on the chin, but that's it. One thing I left out on the adult and child, when you're giving breaths, you're going to pinch the nose and cover their mouth with your mouth to give the 2 full breaths. So pinch the nose for adult and child, cover their mouth with your mouth, and give the 2 breaths. With an infant, you're going to cover their mouth and nose with your mouth, okay, and give 2 small puffs, because you can blow out an infant's lungs. You do not need to blow that hard, okay? You can literally blow them out. So it's more like 2 small puffs. You want to see their chest come up gently. You're going to give 30 compressions using 2 fingers, okay? So the adult is 2 hands, child is 1 hand, infant is 2 fingers between the nipple line or just below. You're going to repeat this the 2 breaths, 30 compressions for 2 minutes, then call 911 and continue until help arrives. All right, lots of information. Choking. So that was adult, child, and infant CPR in 10 minutes, which is unheard of. Okay, for choking, you want to let them cough. Okay, if they're coughing, they're still getting air in. When the coughing stops and their face turns blue and they can't speak, then they can't breathe. So then you want to begin abdominal thrusts. Refer to this picture here. This guy's got his hands wrapped around. You want a fist with your thumb on their belly, okay? And then you're going to take your other hand and cover that hand and do short upward thrusts. Okay, you're going to give them firm upward thrusts until the object's dislodged or until they become unconscious. Okay, so your hand is going to be about 4 inches above the belly button. So make a fist, thumb side of the fist about 4 inches above the belly button. Put your other hand over it, and you're doing doing upward thrusts until it's dislodged or the person becomes unconscious. I don't think we go over unconscious thrusts. Let me see. No, we don't. Not in this class. Basically, you just lay them down the floor and you straddle them, legs on either side of them, and you do the same thing with, you do upward thrusts right above their belly button with the palm of your hand. And you try to get that, whatever it is, and you got to do a finger sweep and look in their mouth. It's a little bit different. I don't think they go over that in your unit. Special circumstances. So if someone's pregnant or obese, you're going to have to go higher. If they're pregnant, then you need to go right, above the belly where you can. You do not want to squeeze on the baby. 1, you're not going to do any good, and 2, you could harm the baby. If you're choking and you're alone, so you're choking, you're alone, you can lean yourself over a chair and try to give yourself abdominal thrusts. It has worked before. An unconscious victim, like I said, they're going to be on the floor. You're going to be straddling them. You're going to have the palm of your hand pushing, giving abdominal thrust, same position. And you're going to have to look in their mouth to see if the object comes up. Because if it does, they're not standing up anymore. It's not going to go flying out. So if it's in there, you might have to do a finger sweep and get it out. Okay? So after, a few abdominal thrusts, you got to check. And then with an infant, you hold their jaw, put them upside down, have their body on your forearm, and you're going to give back blows. And then you're going to turn them over with your fingers and give chest thrusts. Abdominal thrusts, with 2 fingers. Back blows, abdominal thrusts. Okay? I wish I could show you those things. And I can. I wish I had a doll. I can next week if you guys need clarification. You probably have, in the course, you probably have videos that show you. Okay, first aid. So what is a Good Samaritan's Law? I'm wondering if any of you have ever heard of that. So this refers to CPR and first aid, both of them. The Good Samaritan Law protects you if you come to help a victim from being sued. Like say you go and you help a victim and this person, say, dies or something, you break their rib when you're doing CPR, something happens, and they or their family wants to sue you. Well, you're protected by this law, saying that you were trying to do no harm, you were not negligent, you were just trying to help this person, and you were being a good Samaritan. So you would not get sued, okay? If you're the first to arrive at a scene of the accident, it's asking, are you required to do anything? And you're not. If you don't want to, you do not have to do anything. But once you start giving help, you can't just leave. You have to continue to give help. Okay, so I'm going to show you a quick video. And I can't remember what this video is, but we'll check it out. Might be a funny one. Let's see.
There's a place you can go where time stands still, where life.
This is a funny one. Okay, so that is definitely not the way to do it, and he would not be protected under the Good Samaritan's law, but I thought that was so funny. Um, okay, so first things to do, always treat for shock, okay? So shock is caused by extreme physical or emotional stress. Even if somebody sees something that is traumatic, they can go into shock, and shock can result in death if it's not treated. So it's very serious and very important to treat. The symptoms could be they're unconscious, they're bleeding, they're pale, cool, clammy skin, weak pulse. So pale, cool, clammy skin, weak pulse, slow, shallow, or rapid breathing, and a vacant stare. Those are the things that you need to see in even a victim of somebody that just saw an accident or saw something traumatic. Those are the things. And then, of course, if they're unconscious or bleeding, then you need other things to treat as well. So, if they are going into shock, treat any symptoms. You want to keep them warm, raise their feet higher than the heart. The reason you do that is so that blood gets down to the heart, because remember, they have a weak pulse, okay? So their heart's not being very efficient. So you need to help them with that and raise their feet. More blood will get down to the heart. And then throw a blanket over them or a coat or whatever and keep them comfortable and keep talking to them. Hey, I'm right here. Tell them who you are. Just have a conversation with them. Okay, so controlling bleeding. First, you want to make sure the scene's safe and you want to have someone call 911. So, just like in that scene there, if there's any electrical wires or if you're in the middle of the road, anything that could be unsafe, you need to make sure that you and this person are safe. And then have someone call 911. If you can, you need to wear gloves and you want to apply direct pressure with clean, sterile gauze or bandage. A lot of times you're not going to have these things. So anything clean, you want to, you don't want to cause infection, but if it's bleeding a lot, that blood that's coming out will probably clean it of any infection. So anything clean, try to use sterile gauze or a clean bandage. Elevate the injury above their heart because you want to slow down the bleeding. So if you elevate it above the heart, it's going to be harder for the heart to pump blood to it. You never remove the bandage, even if it's soaked through. You want to add more onto it because if it's soaked through, it could be forming a scab or a clot, and that's what you want it to do because you want it to stop bleeding or at least slow down. So if you rip it off, it's just going to start bleeding again. So just add more bandages. If the bleeding does not stop, this is a last resort, and don't you do this, but use a tourniquet as a last resort. And what that is you tie something above, like say if they're cut on their lower leg, you would tie something between their lower leg and their heart. So right above the injury, basically, to slow down blood flow to it. But the problem here is some people tie them too tight and no blood gets to it, and so tissue can die. So that's why they don't really recommend you using a tourniquet, but as a last resort, if you're in the wilderness, and they're going to bleed to death, then you can try to use this tourniquet, okay? Because it's better for them to maybe lose a limb than it is to die altogether. Is that clear? I hope. And then again, when controlling for bleeding, you want to treat for shock. Because when people lose a lot of blood, they can definitely go into shock. Okay. Burns, first degree burns. So signs of a burn, so this is a picture of one. It's like a sunburn. It's the outer layer of skin, red, swollen, painful. Considered minor unless it's covering large portions of sensitive areas, okay? So genitals, face, any area that's really sensitive, if it's covering a large portion, then you need to be treated in a hospital or at least seen. You want to cool the burn under cool running water. This is only for a first degree burn for about 5 or 10 minutes, or you can use cool compresses. Once it's cooled, you can apply lotions like aloe lotion is really good for it. Yeah, so that's first degree burns. Second degree burns, burn is through the first layer of skin. Skin is moist, intensely red, and splotchy. This is a picture of a second degree burn. Blisters usually develop severe pain and swelling. To treat it, you want to clean the area. Don't break the blisters. If the blisters do break, you can apply an antibiotic ointment like Neosporin. If the burn area is large or covers sensitive areas, you need to get help immediately, get medical help immediately. And you always want to watch for signs of infection, okay? And you're going to need to know these for one of your assignment, the first and second and third degree burns and how to treat them. Okay, third degree burns. Bone, muscle, and nerves are burned. This is a picture. Gruesome. Absolutely gruesome. Call 911 immediately. This is a medical emergency. If possible, you want to lay the victim down. You want to cool the injury. Now, this may sound weird. Priority 1, and this is also a question on one of your things. Cool the injury even before resuscitation. This is how you cool it, though. You cool the injury by lightly covering with moist dressing or clean plastic bag. You do never cool it by putting underwater, okay? It can cool it too quickly, and then the person can go into shock. and you do want to treat them for a shock immediately. Because one thing with burns like this is they lose a lot of body heat. Um, Treating these burns is really hard. I don't know if any of you ever been to a burn unit in a hospital, but it is nurses who work on burn units. I don't know how they do it. It's horrible what these people go through, what these burn victims go through. So, priority one, cool the injury even before you would do CPR and stuff. Treat for shock. Okay? Don't overcool, so you do not want to put them in water. You want to remove things. You do not want to remove things sticking to the burn. So if there's clothes or something, don't remove them. Let the hospital deal with that stuff. Do not burst blisters, and do not apply anything to the injury like ointments or anything. Okay. All right, we're getting there. Fractures, broken bones. Check out this one, this femur right here. Yikes! Dislocated bone right there. Okay, so if it's an open bone, open fracture, the bone is displaced and protrudes, sometimes, almost always, through the skin. Nasty, nasty breaks. So what you need to do is you need to control bleeding, because a lot of times these bones can cut major arteries. So you need to control that bleeding first and foremost. You need to treat for shock, and then you can remove debris and rinse the injury. You need to immobilize the areas above and below. That's like a splint. So the joints above and below, you need to immobilize them, put them on some sort of board or something, and you don't do any of this stuff until you take first aid, and they'll teach you how to do it. And then you would splint it if trained, which you guys aren't, and then you would apply ice to decrease the swelling. Okay, if it's a closed fracture, so this, you can tell the joint's a little deformed, or it's swollen, it's painful, victim can't really put any weight on it, they can't move the joint. You want to treat it if it's broken. If you don't know, you want to treat it as if it's broken. If it's severed, if limb is severed, cut off, try to keep it as cold as possible and give it to the paramedics when they arrive. I hope you never have to deal with that. Okay, sports injuries. Cramps, strains, sprains. What's the difference and how do you treat them? So, cramps are when the muscle tightens and won't relax, okay? So with those, you gently have to try and stretch it out, and it's very painful. It can be. I'm sure some of you have gotten cramps in your calf muscles, maybe even in your sleep, and you got to slowly work them out or stretch them out. And sometimes when you try and stretch it, it makes it worse. So you got to try and relax it with a little bit of massage, or just trying to relax the, whatever it is. Strains and sprains. So strains are when it's a pulled tendon. Tendon connects muscle to bone. Sprains are when it's a pulled ligament. Ligament connects bone to bone. So that's the difference. A strain is when you hurt a tendon, which connects bone to muscle. Sprain is when you hurt a ligament, which connects bone to bone. Okay? And then treating them, you want to use the RICE. Rest, ice, compression, and elevation. Okay? RICE, that's the acronym for it. Rest, ice, compression, elevation. All right. Special situations. Okay, seizures. If you see somebody having a seizure, you want to clear the area. You want to protect the victim. You want to make sure if they fall, you might want to try and get them to the ground because they probably will fall and you don't want them to hurt themselves. Protect their head. You want to move everything out of the way so they don't hit anything, because a lot of times they flail. You never want to put anything into their mouth. Okay, that's what they used to say, is to put something in their mouth to hold their tongue so they don't swallow their tongue. Never. Sometimes they can bite that thing and break teeth and swallow that. You never want to put anything into their mouth. Just clear the area, protect the victim. A lot of times they soil themselves. You want to make sure that their dignity is intact. So cover them up, put a blanket or a towel over them, or a coat, whatever you have. Okay, and usually they only last a couple minutes, and then you want to, have someone call 911. Poisonings, call 911, call the poison control number, which is 1-800-222-1222. And if there's fumes in the room or in the house or wherever you are, open some windows. Okay, signs can be vomiting, seizures, confusion, nausea. You want to look around, see is there an empty bottle, what's around. So you can give 911 or poison control any information that you might have. Anaphylactic shock. Okay, so people go into this anaphylactic shock with severe allergic reactions, sometimes for nuts. I've seen it for jellyfish stings, bee stings. They have a difficulty breathing. They may have a red, blotchy complexion. If they have an EpiPen, use it. If you haven't been trained on it, then don't use it. Maybe someone around you has been. Call 911. And then if you need to, administer CPR and rescue breathing. So much information. Okay, obviously don't have to do the exit exam. So, wow, that was CPR, first aid, and the Heimlich maneuver in 30 minutes. I'm sure you have questions, but maybe when you're going through your assignments, you can use this and use my slides and use the information from there to get the answers you need. If you have any questions, please let me know. A couple reminders. So on the 2nd, on Friday, I will be at a professional development meeting, so I won't be able, I might be able to answer text messages if you send them. I won't be able to answer my phone. Probably won't be able to answer many K-mails either, but maybe try and text me. And also on the following Friday, which is the 9th, on that Monday, no, not Monday, Sunday, which is the 11th, that is another hard zero deadline. Okay, permanent zeros. So Sunday night at midnight on the 11th, zeros in the grade book become permanent. And you guys have been great about turning assignments in lately, and I really appreciate that. Okay, I hope you guys have a great week, and I will see you on Friday the 9th. Thanks for watching.